When looking for a long-term care facility, loved ones have to consider the medical needs of their family member.
When it comes to determining what level of care or what type of care providers their family will need, it's always good to have a conversation with the doctor to see what is really required.
A caregiver is someone who is trained to take care of your loved one with their activities of daily living, such as eating, brushing their teeth, daily hygiene, and anything else your loved one might need.
Anything from helping feed, change briefs, help showering, help toileting, whether it's helping walk around, whether the resident needs that or not. Basic daily care activities that resident can't take care of, they assist in.
A medication technician is someone who is trained to give certain types of medications to your loved one.
Their responsibilities are the same as a caregiver, plus they do medication administration.
This could be things like pills or things under the tongue, but there are no needles involved and nothing invasive.
They can't force anybody to take medications. They can only hand it to them.
A certified nursing assistant or a CNA, they're licensed individuals. And so they have more training when it comes to providing care for patients with their medical needs. So some of them are more familiar with some of the medical equipment.
They also are able to take vital signs on your loved one. They report back to the LVN or the nurse, and they keep a close eye on your family member.
A licensed practical nurse, LPN or LVN, depending on your area, they're almost on the same level as RN, but they're not qualified to do certain things.
LVN requires more education than a CNA does. They really help out the RNs. They can do almost anything that the RN does except for invasive medications like IV lines or suppositories.
They are able to take vital signs on your loved one. They report back to the nurse with any changes in conditions.
A registered nurse or RN is someone that requires an associate's or a bachelor's degree. They're able to do almost just about anything that's not invasive. They can clean wounds, they can give medications, they could take orders from the doctor.
They are specialized in giving medications, watching for adverse effects. They're able to report back to the doctor if they notice any changes while your loved one is taking medications. They're able to look at vital signs, trend their vitals. They can do assessments on your loved ones and report back to the doctor if there are any major changes that they need to be aware of. A nurse practitioner, or NP, is a registered nurse that has achieved extra training in order to prescribe medication.
They still have to practice underneath an MD who has a medical license, but a nurse practitioner can do many of those things that an MD can as well. When it comes to determining what level of care or what type of care providers their family will need, it's always good to have a conversation with the doctor to see what is really required. So when it comes to looking at the patient's medication, you want to look at the frequency of when it should be given and also in what route. For example, if your patient or your family member needs antibiotics that are administered through the IV, then you will need a registered nurse to help you with that. But let's say you just have regular medications that are given just by mouth, orally, then you wouldn't need someone with an RN license. You can get a med tech to assist with that.
Check out ZNest's entire library of informative videos on senior care.